Whether we like it or not, technology is changing at both the practice side and the patient side of the healthcare relationship, and sometimes it can be tough to keep up. Hello, I'm Adam Siladi, and this is the eClinicalWorks podcast. With me today is Shari Crooker, who's going to be speaking about that patient-provider relationship and how her office has been able to keep up. Shari, thanks for being here today.
Thanks, Adam.
So let's speak a little bit about, well, first tell us about your practice, size, specialty, what have you.
Well, my name is Shari Crooker. I work at Gwinnett Center Medical Associates. We are an internal medicine practice. We have 4 providers, 1 doctor, 3 mid-levels, see approximately 130 patients a day, anywhere from 5 years old to 109.
Quite the spread there,
Yes.
Quite a lot of employees and stuff.
Yes.
So you probably have a lot of patients coming in here day in and day out, and you have a lot of experience with this. So tell us, how do you think the patient-provider relationship is changing?
It's changing actually in a very good way. Technologically, it's bringing, I think, the patients more into the fold of the practice of the doctor's office. They're not left out. Maybe not left out, but they're not an outsider anymore. They're more part of their healthcare, more part of the doctor's office.
Would you say they're engaged patients?
Yes.
To use the buzzword.
Mm-hmm.
So you do have 4 providers and the support staff and the patients and all that. So why would you take on something like Healow in an environment like that, a busy environment like that?
Why wouldn't you? It's very easy to implement, and it further, I think, again using the buzzword engages, patients in their care. It takes the burden off of my staff. It decreases their workload, therefore decreasing not necessarily the staff, but decreasing the duties that they have to do when the patients are able to schedule their own appointments, book their own appointments, look at their lab work, their results, their PHI on their phone or on their computer. When we don't have to do all of that ourselves. Again, it's bringing the patients into their own healthcare.
Of course, Healow does a variety of things. You mentioned patient appointments. It also, has features for calling patients. It has the patient portal aspect of it as well, things like that. And you mentioned the office duties that often, take up part of your day. So which of those office duties took the most time before you implemented Healow?
Patient appointments, scheduling appointments, I would have to say.
Tell us about that, like any information numbers, anything like that?
Mm-hmm. First thing, 8 o'clock Monday morning, the phones start ringing. Everybody wants an appointment for that day or the next day, and it's constant ringing off the hook. Can you hold, please? Please hold, please hold. And by the time the 10th person gets on there, all the appointments are taken. And we're getting behind in other ways too. It's hard to be on the phone or have 3 or 4 people on the phone doing appointments when we've also got live patients in the office that we want to interact with. Healow, scheduling appointments, takes that out of the equation. My office staff can now engage more with the patients that are here live in person as opposed to being on the phone trying to schedule appointments. Patients go online and schedule appointments at 2 o'clock in the morning or book their appointments, at 2 o'clock in the morning or 8 o'clock at night when we're not even open.
And you certainly don't want that phone call coming in at 2 in the morning for an appointment.
I don't think anybody will take it, but they can certainly try.
So which of the features of Healow, the appointment scheduling or the phone calls or anything like that, which of those features have been the most popular with patients?
Of all the features of Healow, I would say right now they're using the appointment scheduler the most, but that's the first that we promoted out to our patients. But they're really getting into trackers, hugely into trackers now. Now that we're actually able to see them when they come in for office visits, we notified our patients about a month ago that this was now a live feature, and they have, I swear to God, the Fitbit industry just boomed, at least in Lawrenceville, Georgia, entering their blood pressures, doing things like that. They were just amazed that we offered them that technology too. And then we could see it also. It wasn't just a one-sided thing.
So there's that two-way communication, you're not only telling the patients, go maybe do some more activity for your own health, but now you're able to kind of see through the patient portal the fact that they are in fact doing or not doing.
And discuss it at an office visit. It's like, oh, I see you've gained some weight. What happened? Well, they put their notes on trackers. You can put notes in there and we can see those notes when they come in. Or we can say, your activity has increased. This is great, but can you increase it a little bit more? Things like that. Definitely, I think, improves their healthcare and that communication with the doctors. It's not just like you're syncing your Fitbit and you're looking at your numbers. Ooh la la. They don't really know what to do with them. But if a doctor or a provider can actually discuss those results or what is happening with their activity, how awesome is that?
What other functions do you perform through that patient portal?
We actually probably about a year ago started publishing our labs. Well, we've always published our labs to the portal, but we started pushing it out to our patients to look at their labs on the portal first, because when we first started, we were on version 7.2.4. And labs were extraordinarily tedious. There was no next, there was no previous buttons. You couldn't do a cumulative view of a patient's labs. Everything had to be done screen by screen. And my doctor's lab jelly bean, within about 8 weeks, went over 1,000. And yes, those numbers do go outside that jelly bean. Our trainer was kind of interested to see if it would happen, and it does. And it took a long time to get into that workflow to get those labs down. Once we decided to, and I don't know what made me do this, to publish them on the portal first, again, we're pushing that out to the patients that you have control over your health. They don't have to wait for the phone call from the doctor or the mid-level. They can go on the portal within a couple of days and see their results. Then they send us a message. And again, the provider doesn't necessarily have to wait a couple of weeks to go through 1,000 jelly beans. They can get this message from the patient, oh, I saw my cholesterol was a little high. Would you like me to change my medication? Well, when they're in the lab, jelly bean, in that actual lab, they have to make a telephone encounter if they're going to change a medication. Really only if they're going to change a medication, because you don't have medications in the lab encounters. It saves that provider from even having to make that encounter, the telephone encounter for it. The patient's done the work for us. They have voiced their questions before the doctor even calls. It's like, oh, if a doctor would call before, it'd be, oh, your cholesterol's a little high here. I noticed your TSH is this. Oh, and while I've got you on the phone, the patient would start asking all their questions, or they'd call back and say, oh, I wasn't really thinking when you talked to me before. Now they have the time to think of the questions they want to ask the doctor about their lab results. And they get to see them way quicker.
So the response time is a little bit better, and we cut down on those callbacks, those repetitive calls, like, oh, one more thing, and maybe getting back some more of the doctor's time in that way.
Yeah, it definitely saves the doctor's work time, their workflow time also, because the patients are doing half of it for them, basically, and they don't have that stress of thinking, oh my gosh, 752 lab jelly beans. What am I going to do this weekend? Call labs, I guess. Because you look at the numbers and you're just like, oh, they don't have that anymore.
Did you have any qualms of putting some of that responsibility back on the patient?
No, not at all. The way we did the workflow here is I have an RN who will look at labs and will post them for the providers, create those message jelly beans. If the medication has to be changed, or if there is a really critical lab that needs to be looked at, the provider gets it days before they would actually get into their jelly bean sometimes, because they're seeing patients all day for 12 hours a day. Labs kind of come later, shall we say. Now they don't come later, they come way sooner, because I've got this RN who is extraordinarily wonderful and we trust, looking at these first and publishing them to the portal. Again, the patient becomes involved. They get to see these abnormal labs. Oh, I noticed my TSH was 50. What am I going to do? Things like that. Again, it's much quicker to get I don't want to say quicker, it's just faster, more efficient healthcare is what it is. When a provider couldn't get to those labs for a week or so, now he's getting to them within 24 to 48 hours.
Join us in Nashville, Tennessee for the 2015 eClinicalWorks National Conference, October 16th through the 19th at the Gaylord Opryland Resort. Join over 4,000 eClinicalWorks clients just like yourself as we take the national conference to new heights. Our event schedule in Music City is jam-packed from start to finish, kicking off with a keynote and product showcase by CEO Girish Navani at none other than the Grand Ole Opry. Follow that with over 120 breakout sessions, on-site support and training centers, and an exhibit hall with the latest and greatest in eCW innovations. Don't delay. Register today and take advantage of early bird pricing until August 14th, and make your room reservation soon as space is limited. We can't wait to see you at this year's conference, where we'll be kicking up our heels in Nashville, Tennessee.
Another big push in some of the healthcare programs that are out there today, patient-centered medical home, ACO care, some of the other big acronyms that everybody's hearing about. A lot of that focus is on the proactive reaching out to patients, letting them know that they're due for services, or making sure that they're not lapsing in services. Mm-hmm. Does your office do some of that type of work?
We do. We use Messenger. Oh, awesome. The campaigns are just amazing. We have only done so far the birthday campaign, which our patients just, oh, I loved your personal touch on my birthday, blah, blah, blah. Like, okay. And the mammograms right now. We wanted to see how it went, how the office would respond to this, and how our patients would respond to it. And it's been absolutely fantastic. We have had more compliance with mammograms since we started the campaign. Well, I think we started it right after the conference, so it must have been in December, than we have had the previous 7 years that we've had it.
What's the difference there? What was the like before and after that campaign went into place?
Before, you have CDSS, you have alerts, you have ways like to kind of alert you that a patient is due, say, for a mammogram. A lot of times that's overlooked. Because the patient's here and they've got so many other problems. You're dealing with their diabetes, you're dealing with their sinus infection, you're dealing with other issues. And those little health maintenance things kind of get overlooked, no matter how well we want to see alerts in CDSS. With Messenger, again, it puts it on the patient. It's us, fix it and forget it. As soon as you set that campaign, you don't have to do it again. And it shoots those messages out to the patients, email, text, voice message, however you want to do it, or all three. We use all three. And it alerts them that, oh my gosh, my mammogram is due. Or I had my mammogram at my GYNs last year. Oh, and they'll send me portal messages on that. Not a phone call, don't have to go to voicemail, take it off. It's a portal message. Oh, can you please have them fax us your report so we can update your file here? It's updated. See, we've met our CDSS, we've satisfied our alert, and really had to do basically nothing to do it except set up a messenger campaign.
I've noticed, speaking of phone calls, we've been in your office for a few minutes here. There's a lot of activity, but I have not heard one phone call, not one, since we got here. So it sounds like it's working.
Well, and yeah, when it was about 2 years, a year and a half before we went eClinicalWorks, we changed our phone company over. And they do logs, and there was just a much better phone company. And they were kind of stunned that I wasn't lying when we said we got over 500 phone calls a day. Even though we were a 4-provider office, we see a lot of patients and refills, labs, appointments, all these phone calls. And sure enough, we get over 500 phone calls a day. When we implemented Portal, within a year, we were down to just about 100 phone calls.
It's a huge reduction, 80% reduction, just rough numbers there, 500 and 100.
Yeah.
Sounds like a lot of progress has been made there. It sounds like Healow is really part of your practice, operations today. Huge part of it. So how did you make sure that took hold? I mean, a lot of practices, they're hesitant. They think the patients won't do it. They think the office won't do it. But you have been very successful. What did you do there?
Well, I didn't know if our patients would do it, and how would you if you don't present them with their options? All I did was say, this is what I want to do. This is how I see our office is falling behind, or this is where I see our workflow is really bogging down, and here's a way I think we can fix it. Threw it out there. I just started sending email blasts out to all of our patients. We don't require, but we encourage them to put their email addresses on their papers when they come in. So anybody that has an email in the system, we can send out an email blast. Takes however long it takes you to type up a Word document. We've got this great new thing. It's called a patient portal. You guys are gonna love it. Sell it. You can't, if you just sit there and say, we have a patient portal, figure it out yourself kind of thing, well, who's gonna use that? You know, you've gotta promote it. You've gotta make it seem like it's the greatest thing in the world, because I think it is. And every practice should think it is if it's going to decrease your workload, if it's going to increase the flow of the office, if it's gonna make your patients happier, if it's going to, you know, again, bring them into the whole picture. Promote it like that. I did the same when Healow came out, when trackers came out. So just all I did was send out an email blast, and it started coming in like that. Nothing else.
Was email the only way? Because when you say that, of course, I hear all the provider conversations that I've had in the past saying our patients don't give us emails, our patients don't check their emails. Were there any other ways that you
I'd put things all over the office. I would take the same Word document and I just post them in the rooms. I put them in the bathrooms. I put them at checkout. I put them at check-in. We would hand out flyers to, especially when we started setting up the portal, we would hand them out to patients at checkout. Really involved my providers in it too, because they saw the benefit. Once I explained it to them, it's going to decrease. They saw their lab jelly beans going down. They saw the telephone, the messages going down. The nurses saw that they weren't getting as many voicemails anymore. And to have my providers promote it to their patients, like, encourage them to sign up. So you can contact me at 3 o'clock in the morning if you have insomnia. You can send me a portal message on the weekend and let me know what your blood pressures are doing. Don't wait until 8 o'clock on Monday. We're not just a Monday through Friday 8 to 5 office anymore. Yes, it's 24 hours. What isn't these days? We can get to those messages Monday through Friday, but the patients don't feel that they're confined to our office hours anymore. And I wanted the providers to promote that. Send me a portal message. Are you signed up for the portal? I hear them say that all the time. Send me a portal message with this, with that, when you need this. So the providers promote it face-to-face with the patients too. And I think when the patients hear a provider saying it especially, they're more apt to do it.
You've got handouts, you've got stickers and posters and things that you've talked about. You've even got people on message with keywords. It sounds like this sounds a lot like a marketing campaign to me. Did you have to create a lot of these materials yourself?
No, I'm an RN. I'm not a marketing person. I fell into this practice administrator job 13 years ago, kind of by accident. So the whole marketing thing never really occurred to me. I just wanted to use the best way I knew how to get the word out about these wonderful new features that we had to offer our patients. The technological advances that are out there, I'm not going to know if nobody knows. And like I said, the only way I knew how to do it, email blast. eClinicalWorks gives me the Healow stickers. How hard is that to slap them up somewhere? Where your patients stare, like over the weight machine, at the door where they're going to be called back, at checkout, at check-in, in the rooms. They see our little stickers. And again, when I was typing up my email blast, copy a bunch of them off, print a bunch of them off, and stick them on the wall. How hard is that?
Did you have any concerns that patients would just totally reject this at all?
Never even crossed my mind.
Supreme confidence all the way.
Yeah, kind of have to, but also couldn't not have supreme confidence in it. It's a wonderful portal. It's so easy to use and so easy for the patients. And Healow's even easier. I mean, it's on your phone. Who's not on their phone, you know?
You've described several methods that work really well for communicating with patients. Was there anything that you found didn't work well?
No, that's the only things I tried. No, we've not really had any negative feedback. I mean, if the patient doesn't have an email, they don't have an email address. They don't use the portal. They still use the regular thing. We actually have one patient that still writes us a letter for her refills. She cracks me up. And it's just precious. But most patients are like technology. They want to make it easy for themselves. They want to be able to contact us. They want this.
Now, everybody's different, of course, right? So were there any groups of patients that took a little bit longer to come around than others?
No. The first 2 people I had sign up for the portal were in their 80s, and they use it to this day. And mostly it's the elderly people that I find use the portal the most. It's easier for them. They don't, for some reason, they don't like voicemails, but they'll send these portal messages. I guess they feel more in control or something. You know, you hear that beep, what am I supposed to say kind of thing on a voicemail. It's just easier and it's more private, I think. It's more personal for them to be in front of their computer and type what they want to say as opposed to leaving it on some voicemail, you know? But no, every group has been really great with it. Now, patients that we have that we also see their parents, their elderly parents love it, especially Healow, because they don't have to remember the passwords. They just scroll over to their mom's account or their dad's account and send in for their refills. And when we see their children, ditto. All they have to do is enter, their children on the Healow and just scroll over into their account and send in requests for them.
And for our viewers or listeners who may or may not be aware of this feature, I think you're mentioning the fact that you can link through the Healow app on your phone. You can link your patient portal account as well as the patient portal accounts of family members with authentication features and stuff like that, so that you can have easy access to that information, where appropriate.
Yeah, and once you open up the app, you type in your security code, and all of your family members are there. You don't have to use a security code for each one. You're in the app now, and then you just scroll over, and there's their portal.
Well, Shari, thank you so much for taking the time to share your tips and experiences with us. It sounds like you've had a very successful implementation of Healow. Thank you for joining us for another eClinicalWorks podcast. If you have any questions for us, feel free to email us at podcast@eClinicalWorks.com. You can also check out our other episodes on our YouTube page or download us on iTunes. For the eClinicalWorks podcast, I'm Adam Siladi. Thanks for joining us.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.